To begin phase 1, abdominal curl up. Lie on your back with your arms at your side. Tip your pelvis to flatten your back. Raise your shoulders off the floor. As you perform the curl up, hold the head still. Do not flex the neck and avoid bringing your chin into your chest. Breathe out as you lift. Breathe in on the way down. Make sure the movement is smooth and consistent on the way up as well as on the return down. Level 1 lower abdominal strengthening begins with lying on your back. Tilt the pelvis as you tuck in the stomach to flatten your lower back. Maintain this position as you bring the legs up to a 90-degree angle. Hold this while slowly lowering one leg down to allow the heel to touch the floor. Return the leg back to the starting position. Slowly lower the other leg down, touching the heel to the floor. Continue to alternate back and forth. Remember that the starting position is with the legs at 90 degrees. This means that the thighs should be parallel to a wall and the lower legs parallel to the floor. Also remember, as you lower the leg, only lightly tap the heel to the surface. This is important to maintain the pelvic tilt and keep the low back flat. Make sure the movement is smooth and consistent. Start wall squats by standing with your back against the wall. Place your feet 12 to 18 inches away from the wall with the feet hip-width apart. Lower yourself to a seated squat position so that the thighs are horizontal. Slowly slide back up, making sure that you maintain contact with the wall with your back and buttocks area. To decrease the difficulty, you may try a semi-squat by not sitting quite so low. Make sure to keep your weight back on your heels and push through your heel rather than your toes as you come up. Lumbar rotation stretching begins with lying on your back. Keeping the right leg straight, draw the left knee towards the chest. With your right hand, grab the left knee and bring the bent leg across the body until it stretches out. Make sure that as you rotate, you maintain shoulder contact on the surface. Repeat for the right and left side. Hamstring stretching can begin with sitting on the edge of a bed, couch, or sitting on a chair with the leg propped on another chair. Place your hands on your hips or behind your back. Slowly lean forward, keeping the back straight until a stretch is felt in the back of the thigh. It is important to keep the back straight, so lead with the chest rather than the nose as you lean forward. To perform bridging, begin by lying on your back. Bend both knees up with heels supported on the surface. Tighten up the buttocks and slowly raise the buttocks away from the surface, keeping the stomach tight. Slowly lower the buttocks while keeping the buttocks tight. Once the buttocks contact with the surface, then relax the buttock muscles. Extend the hip up as high as is tolerable.
Check with your doctor or therapist before performing any exercises or stretching to be sure these exercises are within your ability. Be sure to understand the correct technique before performing any exercises. Should you experience any pain while performing any exercise, stop immediately.